All right, hi everyone. Welcome to our special webinar on validation, verification, and development of COVID-19 culture. I'm Professor Sam Alcan, and I will serve as your moderator today. This virus is a new challenge for the food industry, particularly when we talk about risks to our employees and to our own business continuity. Getting accurate information about the virus and control strategies, interpreting it so that it makes sense to our employees, and then getting them to adopt these new strange practices as part of the company culture is no small task. Fortunately, we already have a risk assessment framework we can apply to help us. Our HACCP and food safety plan experience is about identifying risks and their controls. Now, while there's a lot of discussion now around COVID-19 controls, these controls are very different than many of our traditional controls because they focus on individual behaviors. And so it's sometimes difficult to think through how to effectively verify we're implementing them properly, and to know that we've chosen valid practices to actually implement. So how does one go about that and encourage a team to adopt a whole new set of customs? Today, we have a pair of experts that have been working closely with food companies during this pandemic to tackle these very issues. And we have an opportunity to get their perspectives and ask them a few questions. Let me introduce them. We have Melanie Newman, who is the Executive Vice President and General Counsel of Matrix Sciences International. She has over 20 years of industry experience as a food law attorney, along with her Master's of Science in Food Safety, to help clients understand the risks relating to the sourcing, manufacturing, and distributions of foods globally, as well as how to successfully manage recalls and other food-related crises. She's been a frequent speaker with us here at Cornell. She's active in the Global Food Safety Initiative, and she's also an adjunct professor at Michigan State University and serves as a strategic advisor to other companies and organizations. We also have Martin Weidman, who is the Gellert Family Professor in Food Safety at Cornell University and the co-director of the New York State Integrated Food Safety Center of Excellence. His research focuses on the transmission and systems biology of bacterial food pathogens and spoilage organisms, and involves the application of a variety of disciplines and collaborations across multiple institutions. He received his veterinary degree and doctorate in veterinary medicine from the Ludwig Maximilian University of Munich and his PhD in food science from Cornell University. So we're very lucky to have them here today. Go ahead and take it away, Martin.
Thanks, Sam. I'm excited to get us started by talking about validation and verification of COVID controls, and Melanie will then take us home on really the COVID control culture piece of this. So the take-home messages from this short presentation will be that we already have a pretty clear laid out set of strategies that are important to minimize the risk of COVID. The challenge as I see it, talking to companies and observing companies, is really to now going to be consistent implementation and documentation. As Sam pointed out, we have a framework for how to do this as food safety professionals. Important key benefits of this system and making this more formal with documentation is not only improved control of COVID-19, enhanced chance of business continuity, reduced enterprise risks, but also reduced risk of legal liability, and Melanie will also touch on this. But to achieve this, and it can't emphasize it enough, written documentation of both your procedures and verification will be essential. So we're going to spend a little bit of time giving you ideas of how to do this. I'm not necessarily going to tell you exactly what to do, because just like with HACCP and preventive controls, the specifics will depend on facility, but give you thoughts how to approach this. The important thing first is that we need to change, I think, our approach a little bit. And some of you may already have that. We used to be sort of in a firefighting mode with COVID-19, but now we need to transition this to a routine system, realizing that we're in this for at least for some of the long run. I think even the most optimistic ones going to see that this is going to be 6 to 9 months, probably considerably longer, that we need to have these strategies in place, because that's how long it's going to take until we have a vaccine and some more permanent solutions. The other important thing as we approach this is I think in the early stages, this was a very much a hazard-focused approach. Our hazard is SARS-CoV-2, so the virus that causes COVID-19. We focused on where is it, what do we do. Now it's important to transition into more of a risk-based approach to that. And I think one key place where this is important is, there's a lot of conversation about disinfection, sanitation, frequently touched surfaces. And don't get me wrong, those are important. But the real risk really lies in person-to-person contact. Another real risk that we've sort of maybe stayed away from is community transmission and how that affects people in our facilities. So transition from hazard to risk, and keep that in mind. And again, nothing different from what we've always done in food safety. The key steps that I'm going to propose to you, and I want you to think of this as sort of a framework of COVID-19 preventive controls, similar to FSMA and preventive controls. First of all, we need to identify control strategies. We need to think about and try to get validation of these control strategies. Where possible, we establish critical limits, monitor the preventive controls, establish verification systems, and maintain accurate record keeping. So all of this, again, things that we are familiar with. Sticking with the HACCP sort of analogy, I think the first thing is what I see as a couple of prerequisites that we need to have. Prerequisite one is you need to have your what we're going to call a COVID czar. This is the person that's responsible for management of COVID-19. That's the person that stays up to date on current information, and that person should have both inward and outward facing roles. Inward facing is training, implementation, and oversight of control strategies, changes, adaptations as the framework changes, as regulatory guidance changes. And the outward facing role is relationship with your local health departments and your communities, which are also very, very important. And I think have somewhat been neglected often in the early stages. So that's one of your prerequisites. Inward and outward could be two different people. In many cases, it might be the same person. Prerequisite number two is really a development and implementation of foundational COVID-19 training. The basics of the virus, transmission, talking about foodborne transmission, that it's not a risk, etc. And then having the records, the training records for these prerequisites. Once we're done with these prerequisites, then we're going to go on to the actual control strategies. We have available a fact sheet where we put out the control strategies that have become pretty standard, starting from practicing social distancing, excluding employees with COVID-19 symptoms or shedding, hand washing, face coverings, avoiding touching your face, cleaning and disinfecting frequently touched surfaces, and at the end, minimize community spread. So those are the key control strategies that we now need to make sure we have the right specific strategies and we verify them. I'm going to level set us a little bit just to make sure we're all on the same page with validation and verification. Validation, the way I define it, and I'm using it here, is are we doing the right thing? What does that mean in this context? The strategy we're using is effective at reducing the risk of COVID-19 infection of our employees. Verification is procedures that are in place to make sure we consistently implement these validated strategies. The simple example is I always think about pasteurization, very simple, very essential step in food safety. Our validation will be scientific data that suggests the time temperature combination we use gives us an appropriate reduction of pathogens of concern. The verification is continuous record of temperature and flow rate, which flow rate then equals time and can be translated into that. So that's sort of the framework. And now we're going to apply these to those different COVID control strategies. Again, this is not, here's exactly what to do. I will give you ideas and thoughts because it's going to be different from facility to facility. And to be honest, some of these are challenging to both validate and verify, particularly in the area of uncertainty. You don't have a good infectious dose model for COVID-19, for example, et cetera, et cetera. So the first one in the group two together is social distancing and face coverings. Validation, I'm going to take the analogy to pasteurization. FDA, through the PMO, says this are the time temperatures for conditions for pasteurization. It's based on some very old science, but individual company does not need to further validate pasteurization. They can refer to this guidance. We're going to do that for social distancing to 6 feet. I do not see any reason for a facility to come up with their own validation, their own scientific papers that do that. Validating that face masks, face coverings or appropriate is a lot more challenging because there's a lot of variation in the types of face coverings that we get. In some places we talk about, surgical mask, maybe even N95 versus, homemade mask versus face shield and combination thereof. You really need to decide what is appropriate for you, and that is not going to be trivial. And digging in all the pros and cons of this would be beyond the scope of this. But, at a minimum, you probably want to have some guidance as to the quality of the face coverings, how they're made. The times of homemade face coverings are probably over. Critical limits, 6-foot distance, and in my mind, a face mask, appropriate face mask that covers mouth and nose. Verification, I think that's where, at least in the early stages, things have fallen down. Some of our suggestions and that we have implemented would be visual verification of both social distancing and face covering. There are technology solutions. We may have to have data on mask performance, etc. Corrective actions, retraining, reorganizing work and people flow, etc., particularly if we can't do social distancing. And then obviously it's important that we record these corrective actions. This is what we implemented in one of our BA plans. We have a social distancing log that tells you what is the activity, who was observed, what was the observation time, was distancing practices followed, were masks worn properly, and who observed it. Very simplistic compared to the early, relative similar to the early days of visual verification of cleaning, for example. There are technology solutions out there. You can basically tag employees through their watches, through their phones, etc. Some challenges around there in terms of can we use phones in our facilities, because that doesn't necessarily go with GMPs, but we may have to rethink some of those. There are companies that offer them as commercial solution, not endorsing any particularly one of them, but we can go out and make this a lot more sophisticated, or we can keep it relatively low sophistication with visual verification. Frequent hand washing, that's a standard we should already have. We know, again, we have the guidance, we have our critical limits, 20 seconds, we probably have to set some frequency. Verification, probably observation, it's the best we have. Nothing surprising on corrective actions here. Avoid touching your face, very, very similar to hand washing, probably even more difficult to verify. But, and a lot of it will evolve around training. Again, no rocket science here. Not saying it's easy, but at the very least, we should do something in the space of trying to verify these procedures. Excluding individuals that shed SARS-CoV-2 from work. That's a bigger one, and that's a challenge one. Critical limits, and I'm not even sure whether that's the right word here or something, but it could be that we have no SARS-CoV-2 shedders admitted to the facility. We have no one admitted with temperature above 100.4 degrees. Verification, again, could be challenging, but that's one that's actually being required. New York State has a required plan for return to business, and there is some requirements for verification and review of records that all employees have been screened before coming to work every day, and there needs to be a record review. So this is going to be moving towards not just voluntary, but a requirement, at least in some states. You probably need to have records that everyone that goes into the facility are screened every day. There are apps available that require people to self-report, certify absence of fever and symptoms. So that's one way. Another one is obviously, temperature, thermal scanners, etc. Again, we need to verify that everyone is going through those, that there's no way around it. A possible verification could even be environmental SARS-CoV-2 monitoring. The idea is if we find positives, then that would indicate that employees came in the facility that carried the virus and shed the virus. I am somewhat skeptical about environmental SARS-CoV-2 monitoring and testing. I think we need to have a very clear plan what to do if results are positive. There are a lot of ways to misinterpret them. For example, these are RNA tests. It could be just dead virus or inactive virus versus fibervirus, etc. But this is probably the only space that I personally see where environmental monitoring would be valuable as a verification procedure. Also, in general, if you want to do environmental SARS-CoV-2 monitoring, a lot of people pushing this out there. Think about what it is. Is it a verification? Is it a validation? Are you just doing it because you want to know? I'm not a big fan of wouldn't it be interesting to know procedures as part of a formal program. Next strategy, cleaning and disinfecting frequently touched surfaces. Validation could be use of approved disinfectants that have been shown to be effective against coronavirus. Critical limits, disinfectant concentration, the dwell time. Verification could be your disinfectant logs, show that you verified the concentrations through titration or whatever it is appropriate. It could be ATP testing to verify cleaning as a part of the cleaning and disinfection procedures. Corrective actions, retraining, improved SOPs. Again, make sure we record these corrective actions. I'm not a fan of SARS-CoV-2 testing for verification of sanitation, because a negative test could tell you that the virus wasn't there to begin with, which is what it usually will be, particularly if the other strategies work, or it could show that your disinfectant procedures worked. So very ambiguous, not valuable for verification of sanitation. Definitely not valid for validation of sanitation, because if you validate it, you would have to actually seed your surfaces with virus and then test that it's there afterwards. So for me, in this space, environmental testing is not a good procedure. The ones many in industry, many of us struggle is minimizing community spread, but it is an essential component of controlling COVID-19. A key strategy probably has to be multilingual, multimodal, so that could be videos, could be conversation, could be pictorial representation, etc. Training on transmission, how to prevent it. Verification could be a short test after training, and could be logs, visual observation to make sure behavior is followed. Obviously, a real struggle will be to verify what is done outside the facility, because that's where it's community spread. We're trying to show this and make this effective outside the facility. Corrective actions could be retraining, use of different training modalities, etc. This is going to be a challenge, and I don't have all the answers, but I'm sure some of you will have ideas. Maybe we can even share some of them in the chat box and bring them up later. Now, all of this, just like with food safety, requires a culture in your facility among your employees to assure consistent implementation. We can police all we want, we can train all we want. If people don't buy in, believe it, and if there's not a culture from the top of the organization all the way to the bottom, this is not going to work, and we're going to have facility shutdowns, we're going to have spikes, we're going to have problems. And obviously, this is particularly obvious for preventing community transmission, but important for all parts of it. And to talk to us more about this piece, I'm going to turn it over to Melanie.
Thanks so much, Martin, and Cornell University for this opportunity to be here with you and all of you who are listening today. Martin did a great job of describing what industry's quote new normal is going to look like. I think we've all heard that phrase, and I do agree that I think we're in this for the long run, and now we need to standardize, normalize, institutionalize new behavior. And Martin also did a great job drawing an excellent parallel to FSMA's preventive controls, risk-based preventive controls thinking. And at least for those of you on the call that are FDA regulated, you're probably thinking to yourself, geez, I just had to go through this. I had to get my folks, my people, my staff through this paradigm shift of HACCP to FSMA's risk-based preventive controls. Now I got to do something else. I got to do this again. Changing behavior can be a little tough. And, it begs a lot of questions with regard to like, how do we really harmonize and institutionalize a culture around COVID-19 and what we've defined as a COVID-19 control culture? And I think where I'm going to talk today, folks, is to draw some parallels through the lens of food safety culture and the great evolution and learnings that we have seen throughout the last, probably 4 to 5 years, that there's been a lot of great work with regard to food safety culture, and also talk a little bit about leveraging and just think about how a lot of this really plays into enterprise risk management thinking, enterprise risk management principles. And if we can kind of triangulate and leverage those two thought pieces or types of thinking, if you will, I think we're onto something. So if we can move on to the next slide. And again, certainly Martin had made mention of, needing this culture. It's, we can have controls in place, but we certainly need a more holistic view of how we're going to effectuate behavioral change, because that's really what we're asking our staff to do and our personnel to do. So what does a COVID-19 culture even look like? And as I mentioned, food safety culture can draw a lot of great parallels. For example, the Global Food Safety Initiative, they've added food safety culture to their expectations. They've created some great position papers, some great guidance and resources with regard to that, and regulators are looking for it. It's still perhaps, maybe a few different definitions out there, but GFSI defines this as a shared set of values, beliefs, or norms that's going to affect the behavior towards food safety in and throughout the organization. So that last sentence there, that last phrase there, across and throughout the organization, that really is striving for that enterprise level integration and institutionalization of behavior. But that behavior is really based on values and beliefs. So this is a social science versus a biological science that we're typically used to leveraging and applying in food safety. But again, a lot of parallels. And I do think too that, being a food lawyer and doing a lot of work in both food safety culture and food regulatory compliance, in contrast to law or a regulation culture, is very much that foundational, am I going to do the right thing when no one's watching? And that is one of the working definitions we sometimes see with regard to food safety culture. And I think that's exactly what we're looking for with a COVID-19 culture. Is are people doing the right thing even when no one's standing there, when the camera's not facing them, when their supervisor walks by? Are they going to always maintain social distancing even while wearing a face mask? Or perhaps that face mask is giving folks that false sense of security we often see, and they're closer together. How are we really conveying that need to do the right thing and follow the procedures and the control strategies like Martin had described, even when no one's watching? So how do we start? The next slide should convey some start to that thinking and some ideas with regard to 2 strategies I'd like to share with you today. One being a very simple back to the basics ABC strategy, and one being, I'll talk more extensively with regard to maturity modeling and how we can overlay a maturity model to a COVID-19 culture. So next slide. The ABCs, sometimes easy to forget, some of the simplest things to apply. And this can help you in any type of policy or procedure you're trying to implement in your organization, whether it be food safety or COVID-19 people safety related. With regard to the ABCs, A is accountability. This is assuming that there's awareness, that there's actually an SOP, there's actually some sort of control strategies plotted out, communicated and conveyed to your staff. So that accountability is there, that your employees know these are the tasks at hand, these are what your responsibilities and duties are as it relates to your job and yourselves and your peers, to keep yourself safe and to keep your peers safe. It's only then when we can really, have evidence and almost prove to ourselves that that awareness has been conveyed that we can ever expect to see behavior change. So once employees are aware of the behaviors that they're supposed to be displaying, then employers should expect to see that shift in behavior. But ultimately, and for those of you who are parents can probably agree with me that sometimes you have to institute some consequences before you actually see that behavior change. Consequences can be positive or negative. So the consequence of good behavior, so a consequence of complying with COVID-19 control strategies like wearing your face mask and maintaining social distancing, your frequent hand washing, etc. Maybe that after 1 week you throw that site a big lunch. I would advocate pre-packaged and reducing touch points. Notwithstanding, perhaps after 2 weeks of high rates of compliance, maybe no COVID-19 positive employee, you have lunch plus. You see where I'm going with this, right? There can be a crescendo of let's reward good behavior, but also communicate pretty clearly what the consequences are for the behavior of noncompliance as well, and the result for noncompliance. So the ABCs can be a really helpful strategy as you start to think about what your control strategies are, how to communicate them, and really how to expect that behavioral change. The next slide starts to talk about maturity modeling and the benefits of maturity models. Maturity models can take on a variety of different forms. This slide's meant to just convey that, look, there is actually great benefit to taking some time strategically thinking about where are we at now? What COVID control strategies have we put in place? Where are we on a scale of either a good, better, best, 1 through 5, a lagging, meeting, exceeding, whatever type of scale works for your own organization, your own risk tolerance, how you might be mapping and tracking, other programs with regard to this kind of scalability to best practice. Your quest for continuous improvement, if you will. And that's really what a maturity model is meant to be able to do, and to help you make some strategic decisions on where does it make more sense to invest on getting to that next level? Where might it not? Where might I be okay being at better versus best in class because the lift in between, that delta, might be just too big, too high, or doesn't align with our corporate risk tolerance, for example. But as it applies to COVID-19 culture implementation, this starts to take on what I define as a pretty exciting opportunity to be able to be used and leveraged as a tool and a strategy. So if we can go to the next slide, maturity models are being widely used, particularly in food safety program assessment and food safety culture. So this is a screenshot from GFSI's food safety culture position paper using this maturity model kind of thinking. Certainly, this is just one element. I'm not going to read you this whole slide or we'd be here all day. But what I did want to do is play with my drawing apparatus on my new Surface Pro, and I highlighted some of this scaling, if you will. So you can see that in the first phase, kind of the more infancy or perhaps weaker maturity phase of a number 1, we really don't have compliance procedures. We don't have anything written down. We're not going to do anything unless somebody tells us we have to, and there's going to be some adverse consequence associated with it. For example, some states and localities are issuing fines for food production facilities who still are not maintaining social distancing or so forth, according to those local or state orders, and the states have that power through their state police powers. You can see the crescendo or the slow growth, if you will, from 2 to 5. There's a little bit more responsibility taken in 2, but they're really going to just rely on being told what to do, or a third party coming in, a regulator saying, oh, you missed something, you need to do this. Phase 3 starts to grow, and again, this is a food safety model, so it's talking about good hygiene requirements, but why isn't that very applicable to COVID-19 with the hand washing requirements? There's some standard operating procedure, there's some enforcement, but really it's only by chance and probably a non-compliance issue that's going to be observed versus proactively looking for that compliant behavior. Ultimately, crescendo all the way to the top, number 5, the most mature phase of this model. And that's where Martin was talking about with regard to there's verification, there's active checks. No one's needing to tell the company what to do. They're not relying on a third party or an inspector or a regulator. This COVID-19 situation is really truly being adopted enterprise-wide as an enterprise business risk and being treated as such. So that's where my little ERM scribble comes into play here. And again, folks, I just wanted to show you the overlays and the parallels and the guidance that we can glean from food safety culture development through models that have already been developed and vetted by the most experienced minds in the field, and through this GFSI model. Now, in the next slide, what I did is just created a very high level stage 1 through stage 5 model, pulling criteria and factors from the food safety culture maturity model stages and how it could be applied to COVID culture development. And what you're going to see is from stage 1 is doubt. Some of the employees may doubt this is even real. Some may still question if this is the big old conspiracy theory. Some may be on the other end and extremely worried about it, but they're not really going to do anything unless they're told to do it. It's a top-down approach. It's kind of a siloed approach. You go to, for example, stage 3. You got a group of people who knows about this. Okay, we understand a little bit more about COVID-19, its risks, how it's transmitted, how it's not transmitted. There's some proactivity, there's some investment, but that investment is typically tied to whether it's going to continue to help the bottom line versus the broader future of the organization, operationally and or not. Stage 5, it's internalized. This is really where it becomes behavioral change. It's institutionalized. Frontline workers are empowered to celebrate and coach peers and to call them out on it when they're not complying. It's very collaborative communication at all levels, up and down. There's an understanding behind the why. It's not just simply waiting to be told. And it becomes a habit, and that habit word is absolutely key. In the next slide, I wanted to have a little fun with this to say, okay, well, let's see how this applies to some of Cornell's control strategies that they've developed. So as you recall from Martin's presentation, control strategies were listed in that center column. I picked 2, probably fairly poorly with my little check marks there. But I picked practicing social distancing and cleaning and disinfecting frequently touched surfaces to try to see how this modeling would work, and modeling it using a maturity model that I just showed you. So on the next slide, you can see the 2 Cornell control strategies that I selected and how it could be mapped on a maturity scale from 1 to 5, from doubt to internalized. This may not be completely appropriate for your organization. Your organization should and can, use this as an example and do your own, because it's going to result and look a little different based upon where you're physically located. If you have community spread issues in your area or not, what your corporate risk tolerance is. And it's really, again, a map to say, today, what stage am I in? Tomorrow, what stage do I want to be in? Next week, what stage do I want to be in? The frequency may not be quite that rapid, but it certainly gives you an idea of where you are, and then it gives you that opportunity to define, what is my North Star? Where do I want to end up? Do I want to end up in stage 5? Am I okay at stage 4? And do this with all of the control strategies that you inside your organization end up adopting for yourself. And the next slide, if if I were you, some of you might be asking, why should I care? What, this seems like a lot of work. What's the worst that can happen if I don't do this, or I don't do this right, or perhaps I don't have the associated documentation, like the verification records that Martin was talking about a bit earlier in this presentation. And unfortunately, folks, you know, there is some negative things that can happen. On the next slide, you'll just see some representative examples of the fact that there could be liability exposure from a legal perspective. There could be lawsuits from individual employees, or worse, their families if they happen to pass away from this virus. And it is alleged that it is caused and or contracted by the employer. That's why we go back to the importance of records, having those records to be able to demonstrate training, implementation of procedures and control strategies. That verification document that Cornell uses, that's powerful. As a lawyer, I would say, like, if I had something like that predated their exposure, I'm, you know, there's never guarantee you're clean as a whistle, but that's a good story to tell. You may be in areas where the localities or states are issuing fines. But ultimately, at the end of the day, this all could and likely will boil down to an enterprise level risk. What that is, you know, bottom line defined as, it's a material risk to the balance sheet in the future of your company, in the future of your business. So ultimately, the worst thing that could happen if these control strategies aren't implemented is you could have walkouts, you could have strikes. I've seen companies with sick outs, just, you know, staging sick days, mass, you know, kind of en masse. This effectively shuts you down. So regardless if a, you know, regulator or a public health agency says to shut down, if you don't have enough of your staff there, whether out of protest and or out of illness, you're shut down anyways. And ultimately, you know, the bad press sometimes becomes its own enterprise risk that becomes very hard to survive. So hopefully this helped paint a picture with regard to a model that could be leveraged and used to build your own COVID-19 control culture, and paints a little bit of the risks associated with not. I will close just by reminding folks that in some states, a written COVID-19 plan is required. So again, staying tapped into your local and your state regulatory requirements, health department and you know, health agency expectations and orders becomes very critical as well. And having the documentation, the verification records to prove what you say, to prove you're doing what you say you're doing in your policy and procedures and in your COVID control plan is highly recommended. Thank you.
Right, thank you, Melanie. That was great. There's a lot to think about here around building this, right, this culture around doing the right thing for COVID-19. And then also what Martin was talking about, right, the things that we need to think about when we want to, you know, verify that we're implementing, right, our COVID-19 control strategies correctly, and then making sure we're using the right ones. So there's a lot to think about. I'm sure there's a lot of questions out there from everyone that's called in, and we had a bunch of people submit some initial questions. And so I think what I'll do is I will start. I kind of want to go back to some of the culture-based questions that we got in here, right? Melanie, you talked about, you know, as we're bringing in, right, these new practices, there may be sometimes, right, a need for consequences. You mentioned teenagers. I don't have quite teenagers, but even my little kids sometimes need consequences. Do we think that there's going to be a period of time where we're going to need to have kind of, you know, quote unquote COVID cops or, you know, floor monitors to make sure that some of these new practices are being implemented correctly within the facility?
Great question. And I probably wouldn't call them cops, but the short answer is yes. I call them COVID czars, which probably is no better than cops, to be honest with you. But I do see the value in having someone at each facility who is responsible for keeping up on the current situation there. How many number of employees are out today? What were the reasons, or were any of those reasons symptomatic of COVID-19? What is the corporate policy with regard to that? or with regard to that facility and their policies and procedures. So ultimately, yes, I do think that is helpful, and it also is helpful just again from a risk management, enterprise risk principled application, is that typically you would have somebody, just like you would have a QA or a food safety manager in every plant, you would have a COVID czar or COVID cop in every plant. So that's a great question and a great idea.
And I'm going to ask one more culture question and then get to some of the ones that are popping up here in the box. Another thing, right? When we talk a lot about building a culture, right? A lot of it seems to be focused within the facility, and Martin mentioned that there is this community aspect to controlling COVID-19. Are there any ideas or best practices on, when someone leaves the facility, right? They kind of clock out, but they're really going to need to take some of these things home with them. Are there ways to encourage that? Kind of check that that's happening? Any thoughts on that?
I mean, this is obviously one of the big challenges. I mean, one idea I've heard one company punt around the idea of providing a bonus to all employees in the facility if they have no COVID-19 cases in a week, in 2 weeks. So therefore, it's sort of obviously, and if it coupled with enough training, people understand that it means their behavior in the facility and outside the facility. I think, sometimes it might be supplying people with the required tools and supplies, providing them with face masks, for example, that they can use at home, not just in the facility, etc. There might be some innovative ways of how to work with communities and do training in the community, etc. I think a lot of it depends on, where your workers come from. Is it a very close community? Is it a community that has a tendency to gather for cultural, religious reasons? How do you help them with that, make that possible? It might be helping them with, even with Zoom, with some internet capabilities to be able to do some of those things in ways that still allow for social distancing, maybe making your facilities available. I think everyone needs to see what works within their context to do that.
And Sam, also, I've seen some companies partner with their local health officials to put on, community-wide educational sessions about this. And then those COVID cops, if you will, the COVID czars in each facility, when they're helping to train and implement COVID control strategies, really getting at the why. Why is this important? Because the why extends past the four walls of the production facility, right? It's to keep yourself safe and those that you care about, you work with, your families, your friends, your colleagues safe. And so that's why it's important to continue those good practices even outside the production facility. Some companies or some industries have a lot of staff who live together as well, and they're coming up with creative ways to do some more socially distant living accommodations, I guess we could say, up to and including renting hotel rooms to put 2 workers in each hotel room versus maybe 4 or more to a room or a small apartment like type of setting. So really starting to think about those factors, including transportation to and from work as well, and how that can be a contributing factor to exposure and contraction of this virus, and helping with creative ways to ensure that that does permeate beyond the facility and the shift.
This is a little bit of a tactic question, but building on this discussion around the communities here in the chat box, when we talk about then kind of understanding or maybe verifying what's going on, is it helpful to kind of have your pulse on what the infection rate is within the area that you work? Is that something you should be paying close attention to, or?
I think absolutely. I mean, you need to know what's going on in your community, not just what it is today, but also is it going up, is it going down? And the more narrowly you can break it down, and the better you know where your workforce is coming from, the better you are. I mean, we can see some very localized, hotspots, clusters, whatever you want to call it. And sometimes that means adjusting some of your policies potentially. So I would absolutely recommend that.
Yeah, and I'll just note an interesting fact today that I saw. Cuomo gave his talk earlier, and they've done some deep dives into particular zip codes in New York City and looked at the variability of the antibody test, which kind of just give you an idea of maybe people who've had it. And the ranges are in some areas up to almost nearly 40% of the people that they tested in that area came back positive, whereas in other parts of the city, it's much lower, right? You're talking, 10, 15%. So that there can be very localized hotspots, and that kind of information can be helpful. So going into the some of the questions here in the box, there's a couple here related to, we're talking about the framework, right, that we, from our food safety plans, HACCP, a little bit from GFSI. Do we need to, and Martin, you kind of answered it, you answered in the chat box. Do we need to revise and update our food safety plans? And then also, how does this relate, right, to GFSI for us?
I think GFSI is still focused on food safety. I think it's important to re-emphasize this. There's zero evidence that COVID-19 is transmitted through foods. And not only is there no reported cases, the epidemiology doesn't support it. The virus that causes COVID-19 is an enveloped virus. It's very susceptible to environmental stress, very susceptible to acid, very quickly killed, basically will not survive stomach acid. All the viruses that cause foodborne illness are viruses that are non-enveloped, so they have a much hardier outer core. They can survive through stomach acid. So it's not foodborne, therefore GFSI should and not really, require anything in this space. This is more of an OSHA employee health type issue. So again, I can't predict what GFSI does, but I hope they do not cross that board and then say it's not a food safety issue, it's an employee health issue, and that's where it should stay.
And just to reiterate, we can't overstate this enough. There is no evidence that this is food transmitted, foodborne, or food packaging related. And so with that, the FSMA food safety plan under the preventive controls requirements wouldn't require a reanalysis or an update because it's not a food safety hazard. So that trigger under that regulation wouldn't trigger for that reason.
So talking about some of the screening practices, and we talked a little bit about also liabilities. If you don't implement a culture, I guess there's also some concerns around liabilities if we implement certain things. So there have been a lot of questions on some of the other things too. If we're talking about screening employees, are there concerns there around temperature taking and things like that might actually then make us liable for something, or that we can't legally ask our employees to do?
I'll jump into that, Sam. That's a good question. There's a lot of conversation around this, but let me start by saying the EEOC has given employers the authority and the right to take temperatures, which typically would not have been permitted, or it would have been deemed a medical examination. So temperature taking is allowed under the EEOC. There has been recent filings by the ACLU, let's just throw some more acronyms in there, the American Civil Liberties Union, that are questioning these kind of infrared or the temperature cameras, that kind of continuous temperature monitoring situation as violating civil liberties, as is being something that's moving towards more of a permanent social monitoring, issue. So that's yet to be seen how that's going to shake out. But as of right now, do employers have the right to take temperatures? Yes. What happens next is the need to analyze, if you're going to keep a record of those temperatures, how long do you need to retain that record for? What are your record retention obligations under the American with Disabilities Act and OSHA? So those are some things that you'd want to definitely check off on with your, internal counsel, your external counsel, to say what are the pros and cons of doing this versus not doing this, of doing this and keeping a record, of doing this and not keeping a record, and also keeping your eye on the changes that are happening. Some states are being sued by consumer advocacy groups regarding their shelter at home, orders. This ACLU thing is happening. So, what's here today could change tomorrow. And again, that just illustrates more the need for your COVID cop team and your COVID cop czar at the corporate level.
And then, that's kind of us enforcing. There's a couple questions in the Q&A box. I think they're kind of around this whole issue of biases and incentives for either, self-reporting of illness or of our peers, right? So using kind of peer reporting to let you know if someone's not implementing, right, COVID-19, related control properly or incorrectly. Are there, I guess, some tips on, again, how do we make sure, right, that that there aren't disincentives, like people aren't afraid, right, to report that they're sick because there might be a reprisal, or report that they know somebody who's coming in is sick because they don't want that person to get mad at them. How do we then kind of help build systems to allow that kind of, I guess, fear-free, right?
No, this makes
Pre-reporting.
sense, Sam. So I think one of the problems we have seen early on, where people have provided sort of like, hazard pay, but obviously it's sort of continuity pay, saying, hey, if you show up every day for 2 weeks, you get a bonus. Now, what happens if someone is on day 12, they have a slight fever, and they're going to get a $500 bonus? Are they really going to report that they have a slight fever, or they want to just squeeze in one more day to get that bonus, which they will not get if they stay at home? So we set incentives, all the best intentions, but it would incentivize people to maybe even do things such as take Tylenol to reduce their fever so they can pass a thermal scan. So we need to carefully assess, some of the incentives that we have put in place to maintain our workforce, to make sure we don't inadvertently incentivize the wrong behavior and really make sure people stay home. Anytime they make less money when they stay home than when they're at workplace, people need the money. They have, their family, their partners might have lost their job, the money is needed. And so we need to be very, very conscious of that and set up the right incentives. With regard to, how do you properly incentivize peers to report issues versus, telling on each other, and how to set that up to not destroy the overall sort of collegial atmosphere. I don't know, Melanie, maybe you have some ideas of how to do that. That's a little bit outside my area of expertise.
Some programs I've seen being implemented in various different companies and facilities, I guess, speak to that, on some level and in some nature. But it's more actually to the flip side, or to the positive too. It's recognizing and celebrating the right behavior, putting their colleague's name in a drawing for those who are exuding that good behavior. But it also goes back to food safety culture. And when you have a culture where you empower frontline workers, every single worker at every single position, as when they see something, do something, say something, this should not really be much different. They should feel empowered, and their peers should know that this isn't about anything vindictive or negative. It's about keeping each other, keeping the organization safe. Just like this kind of empowerment model within, food safety culture, it's about keeping things safe. So whatever format or model that takes, I guess, could be secondary to ensuring that level 5, most mature, enterprise-wide level implementation of program is there, because then your employees will understand that they're doing this for the right reasons, to protect health and safety.
All right, we're Martin, I saw you click, you were going to go answer this question, and I was also going to kind of ask this because I think it's a good point. We're getting near the end of the hour and a good point to make. We've seen a number of facilities have issues, right, with COVID-19 and get closed down. There's been the meat industries but we've also seen it happen in bakeries and on some farms. Are these shutdowns really related to a lack of food safety culture? Do you think that's the reason, or is it that we're just catching up to something completely new?
I think some of it is catching up to something completely new. And again, I wouldn't call it food safety culture. I would call it, a COVID control culture. Maybe it's a more sort of an employee protection culture. And, early on, we didn't know what to do. So I think the meat shutdowns were obviously social distancing was very difficult. There may have been challenges maintaining social distancing in their local communities. So I'm not going to throw a stone on that. But I think going forward, I think we're going to have to be a little bit more, maybe harsh is the right word, if people really don't implement some of these strategies. And these are going to be tough decisions for industry. It's going to be line speed versus employee protection, line speed versus social distancing. And this is, there's economics to it. This is going to go up to the highest level. And this is enterprise, but Melanie pointed to enterprise risk management. And we really need to make some of those decisions. But if you shut down for 2 weeks because you have an issue, running at the usual line speed might not have helped you. So I think tough decisions to make that it's not zero risk. We have to balance different things. But I would not necessarily go back to the shutdowns we had 2-3 weeks ago and saying it's a lack of culture. It could have been, but I think there are a lot of other reasons more likely. And we just didn't know everything we needed to do.
Well, people are still here. I'm going to throw one in that came from the submitted questions, kind of relates to what you were just mentioning, Martin, about how when this all began, we really didn't know a lot about COVID-19 and how to respond. And so occasionally, right, we might be seeing, practice that we've chosen to implement or not implement suddenly become something we need to be doing. Could you talk a little bit about that? Because I know, in the beginning, there's a lot of discussions around masks, and I'm sure that there's going to be something like that later on. So how do we get in front of that so we're not kind of caught flat-footed when these changes happen?
Yeah, I think this is a challenge of UVC, and I think masks. I mean, early on, my argument was I'm not a proponent of masks. I don't think we should use them. There's clear data. The protection is minimal, but I think that's where it's important to stay on top of it. Early on, we didn't know that there was a potentially high number of people that are pre-symptomatic, so before they show symptoms are asymptomatic and can shed virus, and that properly used, some masks might be able to reduce that risk. I think we've even, probably going to see some backtracking on the importance or how important really all this deep cleaning is. I think that's to me is one is, we hear facilities shutting down for 14 days for deep cleaning, and that would sort of imply that environmental transmission is the driver. It is not. It is person-to-person transmission. There's very, very little evidence of environmental transmission. If it is, it tends to be equipment that is, close to your mouth, close to your face. We're talking headsets, shared walkie-talkies, and things like this. And I think if we sort of put social distancing and deep cleaning at the same level in terms of importance, we're going to have a problem. I think we need to really focus on the social distancing part. But we need to communicate some of the uncertainties around some of these things. And if we need to change, we need to explain why. And sometimes it's because we learned more. Sometimes it's because we made the wrong judgment call. But, we can't do 6 weeks of experiments before we decide what to do. And sometimes we will make incorrect calls or calls that later on turned out to not have been the best call. And that's okay, but communication, and so that you maintain, the trust of your employees. I think the challenge with this is that I see a lot of employers don't want to talk to employees at all because it's so much uncertainty. I don't know what to say. And if I say something, I'm probably going to be wrong. I think that's what you would not want to do. And reach out to get help. Reach out to your university, reach out to your extension system, reach out maybe to consultants if you have qualified ones to help you with that communication. But the communication is really, really important. Sam, I think there was another question about sort of social distancing and can you do face masks instead of social distancing, which I think that's another important one. And I think really face masks they don't replace it. I mean, yes, the guidance is if you can't maintain social distancing, use face masks, but it is by far less effective than the social distancing. And one of our fears early on was that people use face masks instead of social distancing where they could do it. So continued focus on trying to figure out how to maintain or institute social distancing is important. You know, yes, often the initial inclination is saying, no, we just can't do it. But I think sometimes maybe it's a different way to ask the question. What would it look like if we do it? You know, do we produce half the line speed, 1/8 of the line speed? What is it? And then go from there rather than saying, you know, we definitely can't do it. I think that's going to continue to be important. And also, I think, again, inadvertent consequences, if we don't do social distancing in one room, how do we explain it to our employees? Because then suddenly it's like, well, room X in my facility doesn't do social distancing, then why should I social distance in the break room? After all, you know, whatever, the slaughter line A, you name it, doesn't do social distancing. And so that's, you have to be really, really careful, because if you don't have it in one area, you do send a message that's probably not that important. So to me, that is a major, major challenge.
And kind of piggybacking on that mask piece, right? There was a second question there around studies on the effectiveness of masks, and I'll just add that there are some laboratory studies, right, around the effectiveness of certain masks. I think one of the challenges that you've got to remember is that mask construction can vary, particularly right with cloth face coverings. And the other piece is that a lot of these, again, are done in the lab, and they're not in the food production setting where we have a much more humid environment. They're much more likely to get dirty. How do they hold up in those settings? And there's a lot of questions there, unfortunately, which is what makes it hard. I think, Martin, right, as you mentioned, right, to do the validation piece on how these masks really work, right? So.
Yeah, Sam, I would maybe just add, maybe people would like to see like a 100% blockage of any droplets, but the fact is that we are only concerned about the really large droplets that generally drop down within those 6 feet. So there are studies that are comparing the cloth face coverings and surgical masks, and when it comes to those large droplets, both of them are pretty much comparable. So it's definitely effective when it comes to that, because the big droplets are the ones that carry enough virus to potentially cause the illness. The small ones are not as big as a problem.
And then I'm looking, if there are any other questions, please type it in. The one other thing that I want to note on the end of that last question on the box, are there any confirmed cases of COVID-19 being transmitted by food? To my knowledge, there has not been a case that has been linked to food. Again, we've talked a lot about the reasons why this virus would not be transmitted to food through food, and I don't think we've actually seen anything that suggests differently. So.
Yeah, I definitely agree, Sam.
Yeah. If there are any other questions, we still have quite a few people on. Feel free to ask or raise your hand. Otherwise, we're getting to 3:10, so we'll let people.
Maybe if we have time, I can add, because I answered the question about the social distancing and the face mask, and I think it's important to emphasize what Martin was talking about, the risk. So, you know, if you cannot do 6 feet, you know, the risk is much lower if you're 5 feet away than if you're 3 feet away. The risk is much lower if you're within those, you know, I don't know, 3 feet for 5 minutes. It's much lower than if you're there for 15 minutes. So it's not this magic cutoff. If you step within those 6 feet, you immediately get infected, but it's all about the risk, you know, how likely it is that you get infected. And the shorter the time is, you know, the lower the risk is. The longer the distance it is, you know, the lower the risk is. So keep that in mind. If you have to step inside, definitely the face covering will reduce the risk, but it's not going to replace that social distancing. So if you have to go in, have that cover, but then step away as soon as you can.
Because we're a bit over time, I want to thank Martin and Melanie for giving this wonderful webinar. It was incredibly informative, and I want to thank everyone who took the time to sign on. Thank you for checking in, and we look forward to seeing you at the office hours, and then feel free to reach out to us if you have any other questions. So stay safe out there.